Sarah Woods speech. Here's the audience. Audience, hello. And we roll right into Sarah Woods.
Hello, I'm Sarah Woods. I'm a certified nursing assistant. Today I would like to talk to you about vaccinating your children against measles, mumps, and rubella, specifically measles. I'm going to talk about what the problem is, why there's a problem, and what the solution to vaccinating our children is. Then we'll go over it and just finish up. Before the vaccine was created for measles, mumps, and rubella, according to an article in the Journal of American Academy of Physicians' Assistants, in 2012, 90% of Americans contracted measles before they turned 15 years old. Fortunately, with the prevalence of the vaccine, by the year 2000, the Center for Disease Control declared the measles disease eliminated. However, an article written in 2012 expresses otherwise. Clearly, vaccines are effective if utilized, but too many people are declining to immunize their children based on fears and false data. I'd like to present why this is a problem, why it's happening, and what can be done to fix it. Measles has not been a significant issue on a global scale for decades, so why should we be concerned with immunization against it now? An article written in the Journal of Health Politics, Policy, and Law states there were more cases of measles reported in the year 2000 than any year since 1996. And of those cases, 89% were unvaccinated. Many parents of our generation have not seen the effects of measles as a plague, so they don't understand the necessity of vaccinating their children against it. However, infants and children are the most susceptible to this disease, usually ranging from the ages of 5 to 9, they get it the most severely. Also, individuals who decline vaccination or their parents didn't get them vaccinated are also at higher risk. Vaccinated individuals may still acquire the disease, but the rate of incidence and the severity of the illness are reduced substantially. According to the CDC, after 2 doses of the vaccine, 99.7% immunization is reported. Also, individuals who decline vaccination are 35 times more likely to contract the disease. Unvaccinated individuals can carry the disease without showing any symptoms. Those carriers who travel to places with outbreaks, such as in France in 2011, with 4,937 cases, were reported in the first 3 months. Those people traveling can bring the disease back to their children and spread it around to their families, employees, and things like that. They can attribute it to the spread in America. Now, vaccines are mandatory except through exemptions, medical exemptions such as an allergy or other medical needs, and non-medical reasons such as religious or personal beliefs. West Virginia and Mississippi are the only 2 states that do not allow non-medical exemptions. So if these immunizations are effective, why are people not more inclined to vaccinate their children? Well, the anti-vaccination movement began with Andrew Wakefield, a British researcher who published an article in The Lancet linking measles, mumps, and rubella vaccine to autism. According to a 2009 article published in the Skeptical Inquirer, the claims made by Wakefield were only using 12 children to find his research. By 2004, the co-authors of his article asked formally to be retracted from this conclusion. The article found that his methodology was improper. Again, he only used 12 people, did not conduct his own research. Citing this one study, later determined to be grossly exaggerated, vaccination rates in Britain began to decrease. They dropped from above 90% to near 80%. This article, published by Wakefield, went global, and other nations noticed that an increase of autism cases was also happening in their countries. While a journal of specialists in pediatric nursing indicated that other research, while autism increased by 373% between the years of 1980 and 1994, the rate of immunization only increased 14% during the same period. If the two were causally linked, you would see a more closely related percentage of increase. The rate of vaccine indicates that there is no causal link between autism and the vaccine. While research has made headway in debunking the myths, people are still refusing to vaccinate their children. What can we do to fix this problem? We need to educate parents of the damages and dangers of measles, providing empirical evidence. We also need to have federally funded advertising campaigns on television which would reach a broad range of the American demographic. We could provide informational pamphlets in doctors' offices to new parents explaining known causes of autism and how both measles and autism, while they may express themselves at the same age in children, do not necessarily cause a link. We should also explore the idea of removing non-medical exemptions at the state level and providing this as a federal mandate. Well, West Virginia and Mississippi already do it. We should encourage other states to do it as well. This provides protection for children and future generations exposed to currently non-vaccinated individuals. So, in conclusion, what is the problem? The problem is that parents are not vaccinating their children either due to medical or religious needs based on one clinically biased research article. And what we need to do about that is to encourage parents to make informed decisions or have state regulations removed or provide federally funded programs so that they could reach a broad range of a demographic. Measles may be considered a disease of the past, but if we aren't taking precautions necessary and utilizing the tools given to us, measles may emerge as a global threat once again. Thank you for listening. I appreciate it.